Florida and Georgia are the latest states weighing whether to expand practicing privileges for non-doctor medical professionals. 27 U.S. states and Washington, D.C. don't require a physician to sign off on a nurse practitioner's work. Organizations like the American Medical Association are fighting back, arguing patients are being put at risk. But advocates say nurse practitioners can treat patients safely. For more on this, I want to bring in Dr. Carmen Kavali. She's a Georgia-based plastic surgeon who has been involved in policy debates on medical titles for years. Thank you for joining us. I have to say, I love when I can get into a nurse practitioner if I can't get in to see my doctor, but I don't know really what the difference is. So just break it down for us a little bit in terms of nurse practitioners, yes, physician's assistants and medical doctors. Who's allowed to do what, and when do medical doctors need to step in?
Sure. Thank you so much for having me here today. First, I want to emphasize that physicians, nurse practitioners, and physician assistants all treat the whole patient. And that I firmly believe we all want what is best for our patients, but we do have to acknowledge the vast difference in training, education, and background for each of these medical professionals. Physicians, of course, have a four-year college degree followed by 4 years of medical school, and then followed by an additional minimum of 3 years of residency training, and that would be to do primary care. That physician finishes with roughly 15,000 clinical hours of patient care. Physician assistants finish a 4-year degree and then do a 27-month program based in the medical model of training, and they finish with roughly 2,000 clinical hours. And finally, nurse practitioners are the most highly variable when it comes to education. I'll talk about the minimums because there are online nurse practitioner programs with near 100% acceptance rates. And some of them are direct entry programs, meaning they don't require any prior nursing experience at all. So the days of seeing a nurse practitioner who worked for 10 years as an RN and then went back to NP school and then went back to care for patients are, I dare say, nearly gone. So they're direct entry programs that require no prior nursing experience, and a minimum of 500 hours is what's required to sit for the nurse practitioner national certifying exam. So, and furthermore, the training of a nurse practitioner is not in the medical model, it's in the nursing model, which is a completely different model of care. That's why they're different professions.
So, Dr. Kavali, talk to me a little bit about the relationship between medical doctors and non-medical doctors. You know, how has it developed over the years, and why is the relationship seemingly growing farther apart? Is this a struggle for less supervision or a response to a shortage of medical professionals? You would think right now, when there are so many healthcare deserts in this country, that they would be coming together.
Well, that is such a multifaceted question you just asked. So I'll start with, what's the role of each in the care of a patient? The original intent of both the nurse practitioner and the physician assistant profession was to work in a team-based model for physician-led care for each patient. What has happened as corporations are taking over parts of our healthcare systems, we're actually seeing physicians being replaced by nurse practitioners or PAs, and what ends up is a patient can go through an entire hospitalization without seeing a physician, and that is never what was intended for team-based patient care.
And so how could expanding practice then for non-medical doctors change medical care, especially in underserved communities?
This is a fantastic question, and I love to answer it because this is actually an argument that has been used for years by the nurse practitioner associations as they argue for a full practice authority, meaning independent practice without physician involvement. The truth is, two things are true. One is there is absolutely nothing right now in any state law that stops a nurse practitioner from working in any part of the state. There is literally nothing stopping NPs today from working in rural areas, nothing. And in those states where full practice authority has been granted by legislation, not through education, we know that nurse practitioners still don't go to rural areas in any greater numbers than physicians do. So the argument that full practice authority is going to be a boon to rural America is just not true. It's a false, hollow argument. What we need to expand care to rural areas is, first, we don't need a two-tiered health system. Every patient deserves physician-led care, and every patient deserves truth and transparency regarding who is caring for them. To increase access in rural areas, we need to increase incentives for professionals to practice in those rural areas. We need student loan forgiveness to practice in rural areas. We need greater broadband access in rural areas that would increase telehealth capabilities that would help with physician-led care in those areas. It's such a multifaceted problem, and increasing scope of practice is not a solution.
All right. Dr. Carmen Kavali, thank you so much for breaking it all down for us.
Thank you.